Hello, professor and class. My name is Marianne Heimbaugh. I'm a master's prepared nurse practitioner, and I am here to talk today about polypharmacy in geriatrics. Polypharmacy in healthcare refers to the use of many medications, often too many, which may have an adverse effect on clinical outcomes. According to Hagawara, most adults aged greater than or equal to 65 years living in the long-term care environment are suffering from the effects of polypharmacy. First, we should clarify the definition of polypharmacy. Polypharmacy can be defined as taking 5 or more medications daily. It can also be described as inappropriate describing of medication. The medication is being used off-label. It shouldn't be used in the target population, like maybe it's on the Beers list and unsafe for geriatric patients, or something else entirely, such as there's an unacceptable pill burden that clinically makes no sense, such as adding a bunch of vitamins or supplements to someone who doesn't stand to benefit from them. In my past as a long-term care director of nursing, I became very familiar with polypharmacy, and my team sought opportunities to reduce this in our facility. Every month, I would run a report that provided a list of residents taking 9 medications or more. We would then examine the list during our monthly interdisciplinary team meeting and determine whether any medications could be safely eliminated. The number 9, which began as an arbitrary number, soon became 8 and then 7 over time as we continued to hone the process. It was surprising how much medication some of these people were taking. It actually was translated into a better clinical metric for the building in regard to return to hospital stay, as people had less adverse drug reactions. We've been aware for some time that increased medication increases the rate of adverse drug reactions, drug-to-drug reactions, and poor adherence. But even more concerning is the associated higher rates of hospitalization, cognitive decline, and increased morbidity, mortality, particularly in the elderly. Boyer's scholarship of integration was used throughout the process as the interdisciplinary team examined each patient and their ensuing medication profile through the lens of pharmacy, social work, medicine, nutrition, therapy, nursing, and activities. According to Thune, the scholarship of integration is about synthesizing information, making connections across disciplines, and interpreting findings in broader contexts. Our interdisciplinary meetings were a perfect opportunity to perform this very type of integration of sciences. I challenge each of you to examine medication lists, no matter the context in which you interact with patients, and determine if we are serving our charges or harming them. Polypharmacy is an issue that affects us all. Thank you.